Hello, I'm Dr. David Murphy. I'm a physician based in Leamington, Ontario in Canada, and I'm also a psychotherapist. Now, many of my patients present with depression. It is one of the commonest issues that I deal with. And so today I'd like to talk to you about what is depression. Now, there are many different definitions around the world, so how you are diagnosed with depression may depend on the country you live in. In North America, we tend to use the American Psychiatric Association's definition of depression, so I'm going to deal with that from that level today. So the American Psychiatric definition of depression uses 9 different symptoms and signs, of which you must have one, which strangely enough is not feeling depressed. The one that you must have is having a low energy, a low motivation, and then you must have 4 out of the other 8 signs and symptoms in order to be diagnosed with depression. Now, if you do the math, that means that there are at least 6,270 different versions of depression. Now, way back when I was a resident in psychiatry, I treated depression with antidepressants. I prescribed a medication, and the medication might vary a little bit depending on the particular symptoms that the patient presented with, but by and large it was one treatment. Now, as a psychotherapist, I need to know the individual presentation of my patient with depression. So I need to understand exactly which symptoms of those 9 that you are presenting with. Because each one of those symptoms has a different treatment. In fact, it has many different treatments. And so you need to find out which one of those treatments will work for you for your individual symptoms of depression. So I'd like you to start to think about, what is your depression for you? What does the word depression mean to you? And even write some of these ideas down so you can refer back to them. So start to think about, how do you feel when you're feeling depressed? What are the emotions that you experience when you're depressed? Start to think about the thoughts that go with those feelings and emotions. What are the thoughts that run through your mind on a day-to-day basis when you're in that type of state of mind and body? And also notice how your body feels when you're feeling depressed. Notice the sensations in different parts of your body. Notice the energy level you experience. And then notice the behaviors that you can and cannot do when you're feeling depressed. Notice the behaviors you tend to go to, or the behaviors you have difficulty participating in, activities that you find difficulty participating in. And start to write all that information down so you can now start to notice what your individual experience of depression is, because in future videos I'm going to give you some ideas for resolving each one of those individual symptoms. And so I would look forward to talking to you, or I hope you enjoy these videos. If you need to contact me or want to contact me, you can connect with me through my website, which is www.drdavidmurphy.ca. That's drdavidmurphy.ca, all small letters, or through my Facebook page, which is Dr. David Murphy, Physician Psychotherapist. I look forward to talking to you.